Hey everyone, and welcome to week 4 of Philosophy 320 Bioethics. I am excited to be here. I've probably had too much coffee, but I'm really looking forward to this topic. It's particularly salient because of what's going on in Canada at the moment, circa 2022. And uh, anyway, it's a cool topic, and I want to jump into it. So today we're going to talk about the ethics of euthanasia. Um, Hilariously enough, when I was younger, I thought the term euthanasia referred to young people who lived in Asia. But no, it is not. That is not what it is. It is a medical practice that is meant to prevent harm. It's something that consequentialists in particular are very supportive of. It's a medical practice of prematurely ending someone's life, often to mitigate their suffering, and it's often people who are likely to die anyway. So these are people who don't have many medical options left. Someone with perhaps stage 4 pancreatic cancer at a very difficult position. Painkillers maybe aren't working very well, and they're going to die in a matter of weeks. And in the interim between the present moment and their death, it will be excruciatingly painful. So this is a practice that, for some reason, a lot of people don't like. They find it morally repugnant or disgusting. And other people feel strongly in favor of it. I've always found it puzzling that we don't talk about this practice nearly enough in our society, given that a lot of people who are older, and those of us who reach old age, I'm quickly approaching that myself, will get debilitating diseases and suffer a great deal. And some of us will lack medical options. So this is going to affect a large number of Americans and people outside of America, really all over the world. But it's just interesting in American society that we don't talk about this nearly enough or very much at all. So it's a medical practice that is sort of akin to putting down a dog or a horse that is suffering and has very few medical options available to it. We think of that as treating the dog or cat or horse or whatever it is humanely, and yet for some reason it's not humane when it applies to humans. So we're going to explore that little puzzle. So traditionally, ethicists distinguish between passive and active euthanasia. Passive is the idea that, so if you've ever seen like an episode of like ER or House or any of these medical shows where someone is on life support and they have a family who are concerned about them suffering, passive euthanasia might be something like taking them off of life support. If life support's the only thing keeping them alive, they'll die on their own. It's not taking active steps to end their life. It's rather letting death take its course, so to speak. Um, so typically in hospitals, although they don't really talk about it very much, this is something that if you have family members who are doctors, medical doctors, like I'm a doctor, but I'm not a medical doctor, but medical doctors, like actual doctors, ask them about this sometime. And I'm sure I would be shocked if you didn't find that hospitals engage in a kind of euthanasia without calling it that. So ramping up people's pain meds, people who are in excruciating pain, just to peacefully end their life. Um, but many people consider, at least traditionally, the former practice to be justified. So the passive euthanasia stuff, letting people die rather than taking active steps to end their life, and active euthanasia. So taking someone off of life support isn't actively causing their death. You're removing a support system that if they were healthy, they wouldn't need. And then death kicks in after that, or their illness kicks in after that, I should say. And it results in death. So traditionally, ethicists, and I say traditionally very importantly because it's changed in the last few decades, but historically and traditionally for the longest time, ethicists, doctors, pastors, priests, politicians, most of the general public considered passive euthanasia to be sometimes acceptable and active euthanasia to be never justified. So when I say justified or acceptable, I mean morally speaking. Although, as I'm sure you're starting to piece together through this class, there's a pattern here. Consequentialists would probably be the most open to both practices. All right. So the moral distinction between passive and active euthanasia is based on a distinction between killing and letting die. And this is an important distinction. It's one that we talked about in the survival lottery. That was week 2. We talked about how John Harris and the survival lottery is something that eschews the distinction between killing and letting die. So that people like John Harris and Rachel's, which is this week's assignment or assigned reading, don't really buy that distinction. They think killing and letting die is a dubious distinction. So you might think, for example, that it's morally wrong to kill a small child by drowning them in a shallow pond, obviously. So that would be murder, and that is killing, right? That's taking of life, that's taking active steps. But you might think it's equally wrong to the extent that you're easily able to save the child, to simply watch them drowned, like let them die. So you can imagine walking by a shallow pond, and this comes from a paper in applied ethics by a philosopher named Peter Singer. So you're walking by a shallow pond and you see a child drowning, and you could easily step into the pond and pull the child out without hurting yourself or putting yourself at risk. You might ruin your shoes, but that's about the extent of it. And Singer thinks it would be ghastly to simply stand there and watch the child drown. So you might think that there's really not much difference between letting the child drown, in Singer's case, and holding your head on the water. But anyway, so that's sort of a way of illustrating it. But you might think there is a difference. Maybe there is a difference. Maybe it's worse to hold the child's head under versus just watching them drown. Like they're both bad, but killing is worse than letting die. Right. So the former has been the former is typically seen as worse than the latter, historically speaking. Now that's changed a lot, and a lot of philosophers are sort of a lot of philosophers go back and forth. So you have a pretty big camp on both sides. So to kill is to actively take someone's life. Well, so to kill is to actively cause someone's death, or actively take their life. And whereas letting someone die is allowing someone to die that you could otherwise save in that moment. So it's really important to keep the in that moment, the italicized part, clear. So to let someone die is to take them off life support would be in a case of this, right? So taking them off life support would be an instance of letting somebody die should they need the life support to survive. You could theoretically save their life though and keep prolonging it with life support, but you might just think it's a life not worth living. So it's important to keep this distinction in mind. And if you're sitting there thinking to yourself, this is a somewhat blurry distinction, you're not wrong. There are going to be borderline cases, and it's not always clear what causing someone's death is versus letting it happen. In fact, that's part of why some people think this isn't, or some philosophers think the distinction between killing and letting die is really not that good. And it's really not that informative. Okay, so with that in mind, let me move my video screen here. So with that in mind, contrary to the traditional view of the moral difference between active and passive euthanasia, Rachel's, who's our author this week, argues that roughly that so Rachel's rejects the traditional view, makes moral sense. So the traditional view is that at least in some cases, passive euthanasia is morally permissible. They live an excruciating life. They're not going to live much longer. These are patients who are they probably don't have a lot of other medical options, and so on and so forth. He argues that not only does the traditional view not make sense, but that sometimes active euthanasia is preferable to passive euthanasia. And he also attacks the difference between the distinction between killing and letting die. One way philosophers like to put this is that it sounds like it's a distinction without a difference. So here's one of his examples that he gives, as I'm sure in the reading. It's about 6 pages. It's not a long reading, but you'll find this in the reading. He says, "What if you have a baby? Like this little baby here, born with Down syndrome, and in some cases will die from the condition after. So it has Down syndrome, and it's got an intestinal blockage or an obstruction. So this will prevent things like eating and that sort of thing. And you might imagine that at least in some cases, um, the baby is going to die from this combined conditions. Like for whatever reason, you can't surgically remove. So in a lot of these cases, of intestinal obstructions, you can just go in and surgically remove the obstruction. It's really not that big of a deal. It's a routine thing. But every once in a while, you get these cases where, for whatever reason, the surgeon's just not able to safely operate without causing more harm to the baby. So they're going to die from the condition after suffering immensely. So you could leave the baby there. So on the passive euthanasia end of the spectrum, you could leave the baby there, let it slowly suffer and die, starve to death, or die from dehydration, which is a miserable, horrible death. You could give it some painkillers, which may or may not do the trick. And it's kind of hard to tell with babies because they can't talk. They can't really tell you or inform you. Squeeze your hand, blink, do something to indicate they need more painkillers. So you could allow them to die on their own, passively, after suffering immensely. But since the baby's gonna, in this case, the baby's going to die regardless. It would be better from a consequentialist perspective. Now, Rachel says, I believe he says utilitarian, but utilitarian is a form of consequentialism. So keep that in mind. And I'll say that again. Rachel says utilitarianism, I'm almost certain. But utilitarianism or utilitarian, that's a form of consequentialism, like we talked about in week 1. But you can see from a consequentialist perspective, or you choose that action, that possible action that maximizes happiness and minimizes suffering. From that perspective, it makes more sense to engage in active euthanasia, to kill the baby, to actively take steps to kill the baby, than to just let the baby suffer longer and die anyway. Why let the baby linger in pain that's difficult to manage anyway, when it's going to die regardless, when you could painlessly or near painlessly end its life sooner? Now, I think the reason Rachel uses babies, and why babies are more difficult cases, is because babies are adorable. So that's why I picked this picture of this baby. It's swaddled. This little creature looks like it's very happy. And babies are, almost everyone has a soft spot for babies. So it's sort of one of those cases where you think, wow, actively killing a baby, oh, that's awful. And if you're a deontologist, you might think it's awful, right? You might think you've in some ways violated the right of the baby to live, or violated your duty not to kill except in self-defense. And this is not a case of self-defense. But you might be a deontologist who thinks that those rights only matter to a point. And once suffering and misery reach a certain level in someone's life, especially when they're going to die anyway, and there's not much you can do for them, then those circumstances or those consequences or a consequential calculus overrides those rights. So, for example, you might think there's the classic cabin in the woods case from a legal philosopher named Joel Feinberg. Feinberg argues, look, most of us think, in the West at least, that people have robust property rights, which means if you own something like a car or a house, it's yours, and it can't just be taken away from you for any old reason. Like the government or a private citizen can't just walk up and grab it and walk off with it without doing something morally wrong. I think there's something wrong with that. But there may be a case where you're in the woods hiking and you have a bee allergy, and maybe you accidentally dropped your HypoPen? Your medication to deal with your bee allergy. You dropped it in the stream by accident, and in trying to leave the woods to go back, you get stung by a bee, and you're beginning to swell up. And we'll assume that your bee allergy is lethal if untreated. And you stumble across a cabin in the woods. As it happens, the cabin's uninhabited. There's nobody home. So you think, okay, and you peer inside and you can see a HypoPen sitting on the desk, something that will keep you alive and treat your allergic reaction. So you smash the window, take the pen, and administer it, saving your life. Feinberg says that you may owe this person an apology and restitution. In fact, you probably do, like when you get back to civilization and whatnot. But in that moment, the situation is so dire that whoever owns this cabin and the hypopen, their property rights are temporarily suspended. Sometimes we think about this in terms of like martial law. If you have an alien invasion or a zombie apocalypse or a nuclear explosion or a pandemic, kind of like we did with COVID, some people think that the state can declare martial law or at least curtail your rights that they otherwise couldn't because of these extreme cases. So even if you're a deontologist, you might be open to this case of active euthanasia being better than passive euthanasia. It's a much trickier road to travel down, morally speaking, uh, as opposed to the consequentialist, who for the consequentialist, it seems pretty straightforward. You're definitely going to minimize the suffering of the baby if you administer or engage in active euthanasia than if you were to use passive euthanasia and let the baby die slowly. All right. So it seems like that's a way of thinking about the this particular example with respect to choosing active versus passive euthanasia, depending on the moral theory you opt for. And based on some of the comments I hear from students, it's really important to keep in mind. I think I emphasized this in lecture one, and if I didn't, I should have. That you can have consequentialist and deontological intuitions, and most of us, in fact, do. So you can think there's something about consequentialism that's true, but there's also something about deontological theories of morality that are true. So consequentialism and deontology, they're both getting at something very important, morally speaking. So Rachel's also attacks the distinction between killing and letting die. So I'm sorry about my keyboard. So he thinks that the mere difference between killing and letting die is not morally relevant. And it's important to keep these cases very, very similar because he's saying if you have two examples where the only difference is I either let someone die or I kill them, but everything else is the same, then there's no moral difference between the killing and the letting die. A lot of times what people will do when they think about these issues is they will compare a case of killing and a case of letting die, where the cases are very, very different. There's a lot of details, important details that vary between those two cases. It's sort of like when you test a hypothesis to see if something hypothesis is true. Scientists will do their best to design the test so that it rules out mitigating factors like other explanations, so that the hypothesis looks like whatever's hypothesized to explain this phenomenon is actually what's explaining the phenomenon. Because if you've ruled out mitigating factors, that's good evidence that the mechanism or the explanation the hypothesis favors is actually what's explaining the phenomenon in the world. So Rachel's gives us an example to try and illustrate the difference between merely killing and letting die, and then illustrating why that's not really morally relevant, he thinks. So he says, and I'm quoting, and this is also in the reading, by the way. If a doctor lets a patient die for humane reasons, he is in the same moral position as if he had given the patient a lethal injection for humane reasons. So he's saying, like, look, if you have this case, so just pause there. If you have this case where a patient is going to die of natural causes, and there's nothing you can do about it. You can give them painkillers and manage it, but there's nothing that you can't stop this. There's no there's no medical treatment that we know of that will stop this. This person's just going to die, right? Like barring some miracle. So if he lets the patient die for humane reasons, like maybe the doctor gives the patient painkillers to help manage the pain and the suffering, etc., then there's really no difference between that and lethal injection for humane reasons, given that letting them die or them dying is probably their best option. How you arrive, whether it's through natural causes or through an injection, you're getting at the same place. All right, it's the place they have to end up. If the decision was wrong, so to continue the quote, if his decision was wrong, if, for example, the patient's illness was in fact curable, the decision would be equally regrettable no matter which method was used to carry it out. So if it's wrong to let the patient die, to not intervene and prevent their death, and it's wrong to cause their death because maybe there's no treatment available, maybe they don't want to die, maybe there's some other mitigating factors, then it doesn't really matter whether you just let them die or you inject them with something that kills them, because in either case, them dying and you not keeping them alive is what's morally wrong. And if the doctor's decision was the right one, the method used is not in itself important. Now, this is very abstract, right? So Rachel's is getting at something that is he's putting it in a very abstract way, and he's sort of talking about this at a very high level. Okay, so let's apply it to a case. So I'm paraphrasing Rachel's because he kind of goes on a bit about this, and it's an example he uses. I simplified a little bit, but it's an example he uses in the reading to really illustrate why he thinks passive and active euthanasia, there's really no moral difference, and sometimes you should favor active euthanasia, and then in the reading, and then killing versus letting die, why he thinks that distinction should be collapsed. So he says Smith, so this is me paraphrasing Rachel's. Smith will inherit a large sum if his baby cousin dies. Smith drowns the child in the bathtub and makes it look like an accident, right? Because he wants to inherit the money. So this is not a case where the baby cousin should die. Smith is only doing this because they want the money. So that doesn't look like a legitimate reason. So remember Rachel says earlier, if his decision was wrong, so in this case it would be the doctor or Smith. So we can swap in Smith for the doctor. The decision would be equally regrettable no matter which method was used to carry it out. Okay, so keep that in mind. The Jones case is just like the Smith case, except that when Jones finds the child has slipped into the bathtub and is drowning, Jones just watches the child drown. Punctuation aside, you get the point. So the first case, Smith goes upstairs and drowns his cousin. Drowns the cousin for the money, right? Cousin who's healthy, not suffering. There's no reason to kill them, medically or morally speaking. Or Jones goes upstairs to do the exact same thing, but finds the child's already drowning and just watches it happen because he wants the money. So the actions of Smith and Jones are equally despicable. Why? Well, for the obvious reason that medically speaking, the child is perfectly healthy, we're assuming. There's no particular reason to let them drown. You're not mitigating their suffering. You're ending their life prematurely, if anything. So killing and letting die. So this is, but Smith only kills. Jones just lets his cousin die. All right, so the actions of Smith and Jones are equally despicable. That seems pretty reasonable. Smith only kills and Jones lets his cousin die. So this is Rachel's ultimate point for this example. And really this applies back to the active and passive euthanasia cases. If killing and letting die does not make a difference to our moral assessment of these cases, the Smith case and the Jones case, right? Killing and letting die seems badly bad. Jones could easily save the cousin. Smith didn't have to drown the kid, his cousin. So if killing and letting die does not make a moral difference to our moral assessment in these cases, which Rachel thinks it shouldn't, why should we think it makes a difference in other sorts of cases? If you really compare cases and the only difference between them, they're exactly the same case. The only difference, morally speaking, is between killing and letting die, then there's not really a moral difference. Like if they're the same otherwise morally, but the life ends based on it killing or letting die, either the killing and letting die was justified or the killing and letting die wasn't. Why does killing versus letting die matter? Now you may think this is a very compelling point Rachel's makes. Maybe we should collapse the distinction between killing and letting die, just like in the case of active versus passive euthanasia, because that's an instance of it. Passive versus active is an instance of or an example of killing versus letting die. The problem is if you do that, which you can, and maybe that's a reasonable one to make, but ethics is like a web. If you make one move here, it has influences over here. So if you collapse the distinction between killing and letting die because you buy this example and because you think it makes sense in active and passive euthanasia, then that's going to have interesting implications for how you think about the survival lottery and whether or not people should be part of a survival lottery when it comes to organ donation. So it's important to keep in mind in ethics, like with many things, things about our, like with many aspects of our belief system, what you believe in one area can affect what you should believe, where you can believe consistently in another. So that is something to think about when we're thinking about the distinction between killing and letting die overall, and then as it applies to cases like euthanasia or the survival lottery, because where you come down on that question is going to have implications for both issues. So that is definitely something to think about.